And Joanne, if you don't mind, I'll do your introductions as well. So Joanne, as we know, is a registered dental nurse by background, and she now also has a new job title, which we'll be talking about a bit later on. I don't want to steal your thunder, Joanne, so I will let you talk about that when we get to your bits, if that's okay. So we're doing a bit of a tag team this morning because Mini Mouthcare Matters is a brilliant initiative and it encompasses the whole dental team. It's not just about dentists in any means, it's about the whole oral healthcare team. And actually, I think very nicely led on from Tribat's talk, because she talked about the initiative that she was doing with mouth cancer and about the leaflets in care homes, but it's about empowering those care staff to be able to feel confident, to have a look in the mouth and to recommend correct things. So really nicely aligned in. I think it was just a coincidence, but actually both quite nicely aligned with each other with our talks today. Right. So the aims and objectives of our talk is to raise awareness of the Mini Mouthcare Matters initiative if you've not heard about it. And I'm going to concentrate a little bit on its background and where it started off from, first of all. And then Joanne's going to talk about where you can fit in and what you can do as Mini Mouthcare Matters has moved into a different sphere, and how we can share best practice to raise awareness and opportunities that are there for the whole dental nursing team. So we know there's an issue with dental disease for children in the UK, but to put it into context, this isn't something that's happened post-pandemic. It's always been there, and actually not just on a UK level, but on a global level. And I think this is quite a shocking slide that shows that 34% of the global population is affected by dental decay. So it's the most common global health condition affecting people. And two really important bits of this slide are, the first one is that it's almost entirely preventable. So it doesn't have to be this way. And the second part is the fact that it's not improved in the last 30 years. So things that we're doing don't seem to be working or making very little impact. So the whole purpose of this initiative is to take a different stance on how to manage dental disease and how we can all be involved with the prevention to try and get to some improvements for children's oral health. And I love this quote by Clark and Vanek from 1984 because it was such a long time ago. And even they recognized in this quote that oral health and quality oral health care contribute to holistic health, and it should be a right and not a privilege. So that many years ago, they recognized the importance that oral health care can have on the general health and well-being of a person. And it's not something that we should be, waiting for later on. It should be something that everybody has access to at the correct, timely manner. So I wanted to give you a bit of context as to where Mini Mouthcare Matters came from. And Mouthcare Matters was born from a very forward-thinking chief executive at a hospital in Kent, Surrey and Sussex, and was developed by Millie Doshi, who's an adult special care consultant in dentistry in that area. And the CQC inspection within that hospital found that the oral health of the adult patients on the wards were really, really poor. And these are two examples of patients that they had on their wards. And the picture on the right-hand side, you can see where the tongue is at the top. That tongue was actually at the roof of this patient's mouth. So they were unable to eat and drink. And unfortunately, the family had to sign a do not resuscitate order because they thought that this lady was actually going to die and not be able to be sent home. Around the time of her really, really deteriorating, they called the oral health care team, of which Millie was a part, and they went to the wards and they saw this lady and they saw how sore her mouth looked. They provided dry mouth gel. They gave instructions to the ward staff to help relieve the pain and discomfort, and they helped to remove the tongue from the roof of her mouth. Needless to say, it felt a lot more comfortable. She was able to eat and drink. And in fact, they didn't even need the do not resuscitate order. She was managed to get better and actually went home. This really could have been a condition looking at life and death because of somebody's oral health care, which could have been managed appropriately. And what the CQC did is they basically had a look, and the investigation that they, or the inspection that they looked at some of the bodies that they had in the morgue and saw that the oral health care of the patients who had passed away were really, really poor. So this chief exec went to Millie and said, we need to do something to manage the oral health care of our patients within the hospital, not just looking from a dentistry perspective. And that's where Mouthcare Matters was born from. It was an initiative looking to make sure that oral health was included in general health for all of the patients in an inpatient setting. So where did Mini Mouthcare Matters come from? Well, at the 2017 British Society of Paediatric Dentistry Conference, which took place in Manchester, that was the year that Claire Stevens, CBE, who's here on the left-hand side with a lanyard on, she was president that year, and it was her drive to push forward Dental Check by One. So that was the year that it was launched, and we were lucky to have Chief Dental Officer Sarah Hurley come to that conference in that year and sit on the table with us as the part of exec committee. And during a conversation with Sarah, she asked me if I'd heard of Mouthcare Matters. I said, no, I've not actually heard of the initiative. And knowing I was a dentist working at Great Ormond Street at the time, she was quite passionate that we need to do something about the children's oral health for inpatients in that particular setting, and linked me in with Millie. And I'm sure you'll all remember this very small picture on the bottom here, but you can see that little jar of teeth, and Claire was on BBC News. So really, paediatric dentistry was having a bit of a moment during that conference. And yes, the middle pictures show that we had a great time, but really important conversations. And what Sarah did was she put me in touch with Millie, and I'd sent Millie an email and said it would be really good if we could meet so we can have a conversation about Mouthcare Matters, and what wasn't mini Mouthcare Matters then, but how we can do something for our paediatric patients. So Millie responded and said, great, I'll come and meet you at Great Ormond Street. So I booked a room for us to go and have a chat. And she turned up with a whole host of people. So I wasn't really expecting that. I was expecting Millie to come on her own. And this is Millie at the back here with the black and red top on. So she came with a group of people from Health Education England and the team that she'd been working with on Mouthcare Matters in Kent, Surrey and Sussex. And they had come and proposed that we move Mouthcare Matters into the paediatric sphere, and we look at something that we could develop which is very similar to it, and said that they have some funding. So this was in December, and the timeline is quite important because the funding came from Health Education England, but they said we'd have to apply for the funding. So we finished the meeting and I went away with Kath, who was sitting next to me here, and that was my dental nurse at the time. And Kath and I went and we had a coffee and we said, God, it's a brilliant idea, but who can do it and who's got the time to do it? And we kind of semi-forgot about that conversation and we carried on about our day jobs until randomly, back in, it was a couple of months later, so it was in January time, I had an email to say, please can you fill a financial bid in for us because we've got the last requests in for what's £50,000 to develop some sort of arm of this. So I had a bit of a panic because it was on the morning of, as usually what happens when you get emails like this, my GA list. So I had a full day GA list and said they needed to have the financial bid in by 5 o'clock that afternoon. So I frantically filled it in, which I'd never done before. I'm purely a clinical consultant by background, didn't really know what I was doing, drawing advice from people who would pick up the phone within their busy day jobs. This is a Monday morning. And I had to contact our clinical director at Gosh to say, we've been given an opportunity to have some funding and it's to develop, mouthcare for our patients. Are you supportive? So literally 5 o'clock, we managed to get the financial bid in, and thankfully we were successful in that. And so we were given £50,000 to develop a mouthcare initiative for children in a hospital-based setting. So knowing that that was quite a huge task and not wanting to do it on my own, I put out a call to arms for the rest of our paediatric dentistry service. And I got lots of people very interested. And so we had a kind of a little stakeholder meeting. And this was myself with, you might recognize some people on here. So the lady on the left with the brown hair in the stripy top is Victoria Clark. She's a paediatric dental consultant at Birmingham Children's Hospital. And Kay Hood, who's with the blonde hair, also with a stripy top. So I obviously didn't get the memo that day. And she's a consultant in paediatric dentistry at Royal Manchester Children's Hospital. The people in the background is Laura, who is a dental nurse by background, now works in Alderhay, Liverpool Children's Hospital. Lorraine, who's a mouthcare lead, also dental nurse by background in Kent, Surrey and Sussex. Millie and my dental nurse with the purple hair, Claire, and Armana, who was one of my registrars. So a group of very mixed people all coming together with the same drive and initiative to look at how we can move mouthcare matters into an adult sphere. So lots of co-collaboration in what we could do to move forward, definitely beyond just dentist and dentistry, because that's what Mouthcare Matters is all about. So from that, we came up with the name Mini Mouthcare Matters, and it took a long time to come to that. There was lots of things thrown around like pedo care. Oh, no, we can't do that. It took a long time to come up with the name Mini Mouthcare Matters. Then we thought, okay, Mini Mouthcare Matters is great, but we need a logo to go with it. So what can we have? So I sat at home with my husband and thought, okay, what particular name can we think of, or what kind of picture or animal or something we can have that children will relate to. So my husband's a big fan of elephants. So he went to work one day, he's also a dentist, and came up with this little logo at the back, and he sent it to me. I said, it's good, but people might think with the heart that it's something to do with cardiology. So let's get something else in there. And then he came up with this and I said, it's good, but now the heart is in the bum and also doesn't really work. So we need to think of something else. So we employed an external graphic design company and we told them the ask was and where the logo would be used. And it would be something that people would recognize as this is the symbol of Mini Mouthcare Matters. This is what integration of children's oral health with general health will look like. What can we do to kind of make it interactive or something that children will like? And for a couple of £100, they came up with this design, which we were a bit taken aback by. I thought it's quite complex. And we went back to the lady and said, what was your intention with this? And she said, well, it's origami. And so they can print them out and the children in the wards can fold them and they can make little paper elephants. And we said, yeah, that's great, but no, it's not going to work for us, unfortunately. So the origami elephant got put aside and then we had to employ somebody else. And eventually we came up with Elwood the elephant. So this is Elwood. He's an elephant because elephants never forget, and he looks like a little molar tooth. So it's just our aid memoir. So people recognize this as the universal symbol of Mini Mouthcare Matters. And it is the universal symbol, and we'll come on to that later on about why it's moved just from a hospital setting into other avenues and spheres, and why having a little bit of a brand and a logo and something that people can recognize is quite important when you're looking at driving forward an initiative like this. Now, I'm not allowed to use the word logo because that was something I learned on very early on with Health Education England. It's a graphic device. So if anybody asks, this is the Mini MCM graphic device. So we came up with our mission statement. And the mission for Mini MCM in its first cohort was to improve the oral health of paediatric hospitalized patients with a stay of more than 24 hours. And by improving the oral health, we knew that would help to prevent poor oral health outcomes. And the messages that we promoted were positive oral hygiene messages to all. And so what that meant is it wasn't just about giving messages to our patients, but also the skills that we gave to our staff, because it wasn't dental staff, we're talking about medical teams, medical nursing staff, healthcare assistants. They actually learned things that they were then able to take back home and impart onto their families. And there's been a return on investment study from the Adult Mouthcare Matters. And what it finds is that actually there's a positive financial return on investment with an initiative like this, because the pay it forward messages are reaped tenfold. It's not just about imparting advice to your patients. The whole dental or oral healthcare team, medical teams take on messages which are then embedded back to their own families at home as well. So it was recognizing that oral health and general health are part of the same jigsaw and they need to come together because oral health is integral to general health. And in 2019, I went to the RCPCH, which is the Royal College of Paediatrics and Child Health Conference. And I saw this tweet, which I thought was brilliant the day before we went to go and present there. And it was a lady who's a pediatrician, and she had just watched a young girl do a talk about her struggles with an eating disorder. And what she had said was, why are we in this day still separating mental health and physical health? Isn't it all just health? And I thought, yeah, 100%, it is all just health. But in some ways, you can almost be forgiven for separating mental and health and physical health because you can't see mental health. Not that it's a reason to not put them together, but for oral health care, even more of a reason, because we need it to talk, to socialize, to eat, to drink. That's the kind of the first thing people look at when you're talking to people. So why are we still separating oral health from physical health? And that comes the tagline, it's time to put the mouth back into the body. And again, very timely, it links in with Sribat's talk from beforehand as well. Not two separate entities. A cancer, not oral cancer and other cancers, a cancer that is linked to everything. So why are we still separating it as a healthcare professional body? So I wanted to talk to you about why it was so important for us to do this and why we started off in the hospital trusts in the first instance. So just a few quick examples of things that I saw on the wards and what kind of affected us and why we realized it was so important to get our medical teams engaged with Mini Mouthcare Matters. Now, this is one of my young patients, Mohammed, who is actually 18 years old. So we may think beyond the age of pediatrics, but even more important for our case, because Mohammed was on the cusp of being referred to adult services. So he was transitioning. So his cardiologist sent him back to us and said, are we happy to transfer him from his dental perspective? I mean, this was the picture that we saw when he came to us. And are we happy? I mean, we would look like an awful institution if we sent him to an adult service with a mouth like this. So Mohammed was extremely dentally phobic. He'd been attending as an outpatient at Gosh for his cardiology procedures for a number of years. And actually transitioning to adult services, his cardiologist wanted to implant this ICD device. So essentially it's like a pacemaker. What he had was a very complex medical condition, slight learning disabilities, but also on top of that, this heart condition, which deteriorated over time. But it's a congenital condition, meaning he was born with this heart condition. So anybody who's born with a congenital condition, which can affect your heart, we know the links between endocarditis, but oral health just was never in his care pathway. So the cardiologist never talked about his oral health. His nurses at his reviews never talked about oral health. At his inpatient admissions, of which he had numerous, nobody talked about oral health. And you can see at point 6 here, he was admitted for a dental general anesthetic for a full clearance for all of his baby teeth. And beyond that time, you can see we're back in this situation. So something's happened, something is missing, and there is a disconnect and a link as to why he's gone to all these medical appointments and nobody has ever recognized the importance of his oral health. So now coming to us, we're in a catch-22 situation. There's a high risk of bacterial endocarditis from the state of his teeth. There's a risk of endocarditis for having the heart condition changed. So the cardiologist wanted to have the pacemaker fitted. We wanted to manage the teeth. And actually sitting in an MDT as a dentist, it's quite shocking because we're not used to these conversations. And sitting with the anaesthetist and the whole family, and the anaesthetist saying to the family, there's a 1 in 10 chance of your child dying if he has a general anesthetic. That's the equivalent of your child going to school with 10 children and one of them not coming home at the end of the day. That really hit home. Interestingly, the family were happy to have the general anesthetic for his pacemaker, but not to have his teeth managed. Doesn't work like that. The cardiologist wasn't willing to put the pacemaker until the teeth were managed, but they didn't want the GA for the teeth because they didn't want that risk. People not recognizing these things go hand in hand. We did talk about the potential to manage his treatment in the dental chair, but he was very anxious. And actually the cardiology team had said to us that the number of times that you will introduce bacteremia by doing numerous local anesthetic procedures, it's better and safer to do everything in one go. So eventually we agreed to go ahead with the procedure. We managed his dental care. We had a whole morning booked out, pediatric intensive care on call. He had his general anesthetic with defibrillation pads on. We all were anxious beforehand. It was an awful procedure. It took about 5 hours in total, 2 hours for the anesthetic, managed his dental decay. And thankfully, we managed to save a lot of his teeth apart from the ones that were very broken down. And then he was referred on to adult services and had his pacemaker fitted. But again, almost entirely preventable if we'd have come to this at the very beginning of his diagnosis. This is an important case to talk about. So this is Jade, who has a very complex medical condition, disability of autism and other complex issues as well. But most importantly, she was non-communicative. So for these children, of which we see quite a lot, their advocates are their families and their parents. But Jade was losing a lot of weight and couldn't communicate why she wasn't eating, why she wasn't drinking. So her parents were really anxious, and then her weight basically suffered so much that she got admitted as an inpatient into Great Ormond Street. So she was being fed through a tube in her nose, so a nasogastric tube, but you can't do that for a long time. So after 2 weeks of being in hospital with this, the gastro team decided with the pediatricians that she needed to have a peg fitted. So she'd need to be fed through a tube that goes directly into her stomach because being fed through your nose is quite uncomfortable. So she was booked for general anesthetic to have this peg fitted in her stomach, to have the food inserted in that way. And during the anaesthetist intubation, they noticed that she had a discolored tooth. And 5 o'clock on a Tuesday evening, got a phone call saying, can you come and have a look at this child's mouth? So I went up to theatre and had a look. And what I noticed is not just one black tooth, but lots of decayed adult teeth with infection associated with them. And probably the reason why she wasn't eating or drinking, but nobody had looked in her mouth. So we weren't able to do any dental treatment at that visit because we didn't have the consent, and she was specifically booked to have that peg fitted. So she did. We arranged a separate general anesthetic, managed her teeth, and needless to say, that peg was eventually removed and she was able to eat and drink as normal. It's quite an invasive procedure, having almost an unnecessary general anesthetic because nobody's looked into her mouth. And another group of patients we used to see quite a lot of were oncology patients. So patients who are admitted for chemotherapy or bone marrow transplants. There are so many other things going on that oral health often gets forgotten, and nobody really looks in the mouth because they're so engrossed about managing their treatment very, very quickly. But what happens for these group of patients are they'll have their chemotherapy, there'll be no problems with them not brushing their teeth, and then they'll come to having a bone marrow transplant. And when you have a bone marrow transplant, your immune system is depleted so much that if there's any source of infection anywhere in your body, it can be fatal. It's only at that point will the ward staff then look in the mouth and recognize there's a decay, there's an infection. Can we get the dental team to come and have a look? And at that point, in a hospital like Great Ormond Street, dentistry is always kind of at the bottom of the list because there's competing priorities for people to get theatre lists. And on many occasions, unfortunately, children weren't able to have their bone marrow transplant because we couldn't get the dental treatment managed in the first place. could have been avoided if somebody looked in their mouths as part of their assessment on admission. So a big problem for those medical complex children, and we know the statistics, we know that there's obvious decay. So 31% of 5-year-olds, 46% of 8-year-olds suffer from obvious dental decay, and a huge number of general anaesthetics with a massive cost of almost £43 million, an almost entirely preventable condition. And for particularly hospital patients, it's really important. So apologies for my abbreviations, but this slide basically shows that 20% of patients in pediatric intensive care can develop pneumonia. And the reason they can develop pneumonia could be because of their poor oral health. And if you develop pneumonia, that can then cause further infections, not being able to eat and drink, which means you're then in hospital for a longer time, increasing care costs. It affects our overall health and well-being. And we can prevent pneumonia, which is caused by a hospital admission, from just having good daily oral health care practices in place. So the whole point of mini MCM is to make sure that we make every contact count. We get ward staff, healthcare assistants, people on admission to make every contact count and lift the lip. In the medical pediatric nursing curriculum, there's no mention of oral health. And actually, we're working with quite a few other societies at the moment, including speech and language therapists, because there's no mention of oral health. So a speech and language therapist who works in the area of the mouth to be able to get kids to eat, drink, worried about unsafe swallows, then there's no mention of oral health in their curriculum. So we have a bit of a way to go to try and connect all of these services together. But I don't want to just focus on the nursing aspect of things. It's also about our medical counterparts. And this is a patient who was referred to me by a very prominent professor in neurology. And they were basically saying this child is suffering from gross dental decay. They need an urgent general anesthetic, but actually they don't eat orally. So if you're not eating orally, you're not having any sugars, you're not going to get bacteria attacking the sugar, you're not going to get dental decay. And they had gross calculus. So this patient was prioritized over other patients to come to the wards, to the department, because we thought they would need a general anesthetic, but actually it's just calculus. So even our medical counterparts aren't aware what's decay, what's calculus, what's gum disease. A lot of progress needs to be made to be able to training our allied healthcare professionals beyond dentistry. And whilst we get nursing staff asking, have you opened your bowels today? It can be something as easy as asking, have you brushed your teeth today? It takes 2 seconds to ask that question, but unfortunately it's not something that's done. And it's really important to talk about dental neglect, I think, because the definition of dental neglect, but from the RCPCH and British Society of Paediatric Dentistry, is the persistent failure to meet a child's basic oral health needs, which is likely to result in the serious impairment of a child's oral or general health or development. Now, this definition of dental neglect really applies to, as we think as dental professionals, to families. So it's for families who don't bring their children when they need an appointment, families who miss repeat general anaesthetic appointments. But I ask you, if we have a child who's admitted to a ward for, say, a broken leg or for appendix to come out, and they present with a mouth like this, and the team on the wards don't address it and don't say anything, are the ward staff, are the medical teams then guilty of dental neglect? So what did we find in our wards? We found that mouthcare was low or no priority at all on admission. Some inpatients who had been there for more than 3 months hadn't even brushed their teeth once, and they didn't have a toothbrush or paste provided for them. And multiple emergency general anaesthetics were having to be booked for our oncology patients because at last minute they were found to be an infection risk. So the opportunity for examination and admission at diagnosis just wasn't on the agenda, which puts pressures on the resources at a later date. So once we had the concept of Mini Mouthcare Matters, we then went and launched it to our paediatric counterparts at BSPD in 2018. And we had a lot of interest and a lot of people keen to embed this in their practice. So what we asked everybody before they came for our training was to complete some baseline audits. And then once they've had the training, go back to their trust. And our audits were transferable. We allowed people to modify them based on the specific wards they were at. So we had a mouthcare survey for our nursing staff, so what their knowledge was of oral health, if they'd had any training, an inpatient oral health questionnaire. So for children and parents, when your child was admitted, was it an emergency? Was it an elective admission? How long they had been there for? If they'd asked for a toothbrush and paste, was there any given? And how would their oral health status been throughout their stay in the hospital? We also had a look at some notes to see if any recording of how their oral health was recorded in the notes for the patients as well. And then we developed our training based on what we found. And our training came in fourfold under 4 simple principles. So we were providing staff with the knowledge of why mouthcare was so important, ensured the staff was skilled to provide good mouthcare, and made sure the patient had access to effective mouth care products. And those ward staff who had the training were there to be supported by those with the enhanced oral health care skills. So we essentially asked each ward in whichever hospital they came from to put forward an oral health care champion, and those champions were trained by us. So we delivered a full day of training. The training was delivered by myself and my 2 dental nurses, and majority of the resources were developed in collaboration with my dental nursing team, because essentially Mini Mouthcare Matters is delivering better oral health toolkit packaged in a different manner. Evidence-based things that we can give to all of our healthcare professionals, which is easily accessible and utilized in a way that can suit what they're trying to deliver. Now, it might look quite complex, but essentially what we were asking ward staff to do is when a child's admitted for anything else, lift the lip, look in the mouth and recognize their mouth care. Are they deemed to be a low, medium or high risk for their mouth care whilst they're an inpatient in the hospital? We went through about 18 versions of this mouth care form, and we came up to this final version in collaboration with lots of mouth care staff. And you can see there's the little elephant there, Elwood. We got the single elephant or the double elephant. And what we did is we gave laminated cards to ward staff to say that if your child was recognized as being able to brush their own teeth, they would keep the single elephant by the bed, or if they had a double elephant, so the mum and baby elephant, that would be kept by the bed as well. So ward staff were aware that that person needs some help with brushing their teeth, and they felt empowered to do that because we delivered the training. So on top of the mouthcare assessment tool and the training, we developed a hospital guide. So it's almost like a 150-page guide on a Bible for everything to do with mouthcare for children in a hospital setting. Many hospital wards didn't have a mouthcare policy, so we developed a template for them to follow and embed based on their specific patient needs, and a product order information form. So everything we recommended for our staff on the wards, we put in here with the NHS supply chain code, how much it would cost, where they could find specific things that would benefit their patient group as well. And we also developed some nice leaflets and posters, which were an aid memoir for staff on the wards, as well as for the patients when they came in. So the middle one was a big roller banner that you could keep out in the wards, in the entranceways to the hospital. So as soon as a patient comes in, they'll see the first sign that says staying overnight. If you've forgotten your toothbrush, please ask for one. So little reminders that importance of oral health care when they're coming in for a hospital procedure. So elephants should never forget, and neither should we. So the assessments were deemed to be streamlined, they were easy to use, and they could easily incorporate it into all of their practices as well. We wanted to make sure we engaged with everybody. And to be able to do that, we had to recognize there was a problem. So we asked them to look into their hospital Datex form, so incidents. And there were so many incidents because many people had been using pink foam swabs, which are actually banned in Wales, but still used in some hospitals in England. And pink foam swabs detach, but that's all they were using for mouth care. And one of the key things we would say when people came for training were, if you were inpatient in hospital and you were there for 2 weeks, how would you like your mouth to be cleaned by a pink foam swab dipped in Corsadil? It doesn't really work. So identifying areas which they're lacking in hospitals and then making sure they're training up and going back and giving those messages of what works and what doesn't work. So in 2019, we launched Mini Mouthcare Matters. So this is the poster in its full glory. That's me with my t-shirt because I'm a bit of a geek and I had everything made possible with a Mini MCM logo. And what you possibly can't see here while I'm putting my t-shirt down so far is because I was actually, I think, 37 weeks pregnant in this picture. So just before the launch of Mini MCM. So the day before we went out ahead of the launch, I had my son. So this is my second child. And so the whole team had to go and deliver the training for us, and they were brilliant. And it was led by my dental nursing team. There was no dentist there delivering the training, and they didn't need to be, because it's not about dentists, it's about the whole dental team. And this is actually before I even had the chance to hold a kid. And my husband saying 1, because we're very, very geeky. And instead of dental check by 1, we've got dental check by 1 minute. So we are a family of dental geeks, unfortunately. And so this is what I ended up coming home with then. So my little son and my daughter, who was looking after him as well. And this is the number of hospitals that we managed to train throughout that period of me with my small baby. I was on maternity leave. The £50,000 funding, which paid for my nursing staff and for me, and some of the resources, some of it I paid out of my own pocket. basically beyond this point, all of this training was delivered out of goodwill because we really believed in the initiative and the project. And we actually trained just under 100 professionals, so practice educators, speech and language therapists, ward matrons, over 37 trusts across the UK. So we really, really had a big reach. And then 3 months after my son was born, we went to the Royal College of Nursing Congress in Liverpool, and we had a little stand about Mouthcare Matters, mini Mouthcare Matters. And important to recognise that in this picture, I'm the only dentist. Everybody else was dental nurse by background, and really, really pushed forward the agenda because they knew they were making a huge difference in their role and not stepping beyond what they felt as comfortable. So even though they were with medical nurses, actually medical nurses had no idea about Mouthcare. And they came up and they were asking us, oh, what's this and how can we get involved? And they were really, really passionate about driving the whole initiative forward. So we did some audits at Gosh, and I won't go into too much detail here. We basically found out they weren't doing anything. They didn't have the correct toothbrushes, toothpaste. They weren't recording anything. There was no Mouthcare assessment tool. And that was pretty much what we found on a national level as well. No Mouthcare policies. People had no training in oral health care management. So very, very needed. So we delivered multiple training days, getting people involved from all across the UK. And at some point, I had to take my son with me because I had no childcare. So I was delivering training with him hanging over my shoulder. So lucky my dental nurses are brilliant, actually, because they were brilliant babysitters at the same time as well. So we're all best friends. They all look after my kids. They're amazing. We help each other when we need to. And our feedback from our training was that people said they enjoyed it all. They learned new things. There's minimal oral care in the undergraduate nursing curriculum. It was the first training day they found regarding mouth care and oral hygiene. And it was really good to get input from different specialties and roles within their trusts. It was a good initiative, long overdue, and excellent speakers. And I only spoke for a little bit. Most of it was led by my team. So what we did is after we delivered the initial training, we had 3 follow-up days for all the trusts that we trained. And that was between January and March, the dreaded March 2020, over what we were going to do in March 2020, obviously when COVID hit in. We had lots of interest. So University of Peninsula actually sent their dental education lead, who came and took our training, modified it and packaged it into an interprofessional education module. So 3rd and 4th year dental students down in Peninsula were trained in mini Mouthcare Matters, and they were going out to their local hospitals in an area of the country which actually has very limited dentistry, especially for children. And they were training in new intakes of medics in the hospital. So every new intake in February and September, they were going and training that staff. And this is mini Mouthcare Matters and why you need to be doing it. We had a lot of interest from paediatric hospices, children and young people mental health service, and we were getting interest from people globally. I had messages from people in Korea and Bangalore and China to say, we really want to embed something like this. But then what happened is, as I told you, the funding had ended and we were told to stop promoting the program. So only 1 year of funding, everything carried on for goodwill for the project, and we were looking for sustainability. So we had conversations with the BDA, with Peninsula Dental Social Enterprise, Oral Health Foundation, of where could mini MCM sit in the future, because we didn't want to give up all of the drive that we had and the passion going forward. And then in October 2019, one of my friends sent me this screenshot, and they were at the BDIA conference and had heard Chief Dental Officer talking about mini Mouthcare Matters in this presentation about residential special educational settings. So I was like, oh, that's quite exciting. She's put our little logo in, and I didn't really know what it was about at all. But then I got a contact from Sarah Hurley saying, will you come and present to the Child Oral Health Improvement Programme Board? So this is a group that's run by Public Health England, and their mission is to improve children's oral health from a public health perspective. So I gave them a presentation based on what our findings were and what we were delivered so far, and talked about how we were looking for sustainability because there wasn't any funding to go forward. So at the end of this talk, I got an email from the Chief Dental Officer to say, look, we are driving forward something very similar to Mouthcare Matters, mini Mouthcare Matters, in a residential setting for children with disabilities. And we've got a job advertised. So will you be willing to apply for the job to go forward? So I was still on maternity leave at this time. But yes, I applied for the job. I went for an interview and luckily I was successful. So mini Mouthcare Matters then moved from a hospital setting, which we are still doing work on, into residential special education settings. And this is part of the NHS long-term plan to improve oral health care for children with disabilities who are in residential settings away from their families on a day-to-day basis. And it's really important because as part of the long-term plan, dental checks are part of the sensory initiative. So together with audiology and optometry, we're looking at improving the care for children in these residential special educational settings. And the reason why it's important is because the first ever survey that took place for special education settings was in 2015. And what they found in these settings were that children were likely to have a greater severity and extent of tooth decay in comparison to their mainstream peers. So children aged between 5 and 12 presented with visible plaque, almost double those than what you'd find in their mainstream peers. And those children also had a higher number of teeth affected by decay and were more likely to have one or more teeth removed in a hospital setting. And children within these settings were deemed to be vulnerable because the impact of poor oral health on their general health and the fact that they were unable to have the specialist services to manage it. So very limited specialist service looking for pediatric dentistry in the country. So they were deemed to be a vulnerable group. And as a result of that, Public Health England provided a report in 2019. And the statement was that children and young people with learning disabilities and autism experience poorer oral health outcomes than the general population, a big inequality. And the reason why they thought they needed to have carer support to undertake daily oral health care routines and access care. There's a reduced access to dental services. They can be difficult in communicating their source of pain, and the dental environment can be a cause of discomfort and anxiety. So there needs to be improved dental services, but with a role on prevention. So the dental services is one aspect of the plan, and then prevention is the other aspect. So Mini Mouthcare Matters is also applicable in a residential special educational setting. So we had some funding to develop a Mini Mouthcare Matters team, and we put out an advert in NHS Jobs, and we put out adverts separately to all different groups to say we want non-dental healthcare professionals. I was happy to have dentists apply as well, but I wanted a non-dentist on the team because it was really important that we get all the oral healthcare team involved in delivering Mini Mouthcare Matters, because it isn't about dentists when it comes to this initiative. And so we put out an advert, and we had 3 project manager posts, and the person who scored the highest out of everybody is Joanne, who's our tag team with me today. And I'm going to hand over to Joanne now, because from a dental nursing perspective, really important to see how you link into this initiative as well. Thanks very much, Joanne.
Thank you. Can you hear me okay? Next slide, please, Ush. So Ush had asked me to be part of this presentation, and we didn't know whether to go straight into what was Mini Mouthcare Matters, but I just wanted to give you an understanding of where I had come from. So the reason I got the title of I'm Just a Dental Nurse is then years and years ago when I first started working in dental practice, and anybody used to say, what do you do? And even family used to describe me as, oh, she's just a dental nurse. And still to this day, I come across the odd people who will say, oh, I'm just a dental nurse. But actually, when you look at it, you're more than just that. So I started off as a receptionist and then qualified as a dental nurse, and now got 32 years service, which I can't believe I've been here that long. So next slide, please, Ush. So my journey. So I started off with reception, then dental nursing, and through extended skills and continued professional development, I went on to do orthodontics at Leeds Dental Institute, and then qualified in oral health promotion. Through the oral health promotion, I then did my adult teaching, which then enabled us to do the Wrigley's Oral Health Advisor role, which was really good because that was part of the Oral Health in Action programme. And then a few years later, was given the opportunity of a health trainer hub coordinator, which was available on secondment. So that is where your employer would loan you out to another service. And it's really interesting looking at this role, because initially when it was first advertised, I inquired about it, was really excited, but then got the fear of God and thought, no, I can't possibly do that. I'm just a dental nurse. But actually, they didn't actually recruit to that post. And the manager actually rang me and she said, why didn't you apply? And I said, because I don't feel like I've got the skills and the knowledge to do that role. And when she went through the job description and you look at all the skills and all the extended skills that you have and the continual professional development that you gain over the years, you can transfer anything that you've got into a completely different area. So following that, I then went back to the service, and for the last 21 years, I've actually worked as the Oral Health Promotion Lead Manager for South Tyneside and Sunderland Foundation Trust. Next slide, please. And this is just a little snippet of some of the information that we've done over the years. So we've done programme work with National Smile Months and mouth cancer campaigns. We celebrated the 70th years of NHS. And these are some of my previous colleagues, because obviously I've now left that structure. We had a bid for £10,000 that we won from Wrigley's, which we were able to do a tooth-friendly roadshow in special educational settings. And we've also done some work with Mouthcare Matters within our acute trust. Next slide, please. But then in March 2020, obviously COVID hit, which was actually the worst year ever. And the Times magazine actually put a cross through their front cover to say that it was just awful. The end of January 20, we then left the UK and the EU, sorry. And then obviously in March, COVID hit. Next slide, please. And obviously within 2020, lots of us were actually redeployed from our services. So whether or not you worked in dental practice or you worked in a community or a hospital setting, lots of us were redeployed and completely out of our comfort zone. But over that time, so back in March 2020, I was actually off sick with pneumonia at the time with suspected COVID. And when I went back to work in the April, I had 1 day within that area of work and then moved to COVID advice within the acute trust. And that was to provide guidance, arrange appointments, give results to staff and families on their COVID swabs. During the time, I think a lot of us all reevaluated our lives. We looked at what we were doing. We looked at the people that we worked with, our friends, our family. We all survived. Well, most of us hopefully survived the toilet paper shortage. But it was at a time where you were able to sit back and think, actually, am I doing what I really want to do? Or do I want to try something different? Next slide, Ush. And at that time, an opportunity came along where I was told about an opportunity for Mini Mouthcare Matters. And it was actually my line manager at the time who told us about it and said, you know, this could be an opportunity. So I went for it. And I'm so pleased I did, because I don't have to sit there and think, I wish I'd done something, rather than thinking I've actually done it. So when opportunity knocks, what I would say is, as a dental nurse, you really need to go for it. And if it's stepping out of your comfort zone, that's fine, because you'll only know if you do it. So as Ush said, I applied for the job, took on the role as Mini Mouthcare Manager, project manager for the pilot. And within a few months, I knew I'd made the right decision. I was gaining new skills. My confidence was actually going through the roof, because I was doing things that I'd never been able to do, even though the job that I had been doing within the trust and the organisation was around oral health. This was given as an insight into the bigger picture, the wider community, national projects, working with different people. And it was a fantastic time to do something within that COVID time. A few months later, an actual project came up for the project manager SES role. So that is the overall project manager. So what I did was I applied for the role, and luckily enough for me, I was successful and now manage the team of project managers that we've got on board, and also overview on the SES project. Next slide, please, Ush. So the project team, so this includes the Mini Mouthcare Matters. So we want to make sure that every contact counts, ensuring every person who comes into contact with a pupil within a residential school recognises the importance of good oral health and the impact of oral health, and having an understanding of the impact of general health and well-being. So that includes your support workers, your education staff, your SALT team, physiotherapies. So what we did was we looked at the training, the knowledge and the skills and the tools. We've developed e-learning packages for the oral healthcare team. So it's not just about your dentist, it's not just about your hygienist or your therapist, it's your dental nurse team. Dedicated a Mouthcare lead champion on site. So every residential school that we've worked with, they now have Mouthcare champions in place. The e-learning for care and school staff and allied healthcare professionals. So we've included an e-learning package solely for care and support staff, but then there's also an e-learning package for allied health professionals. So that includes general dental, general medical physiotherapy, there's activity coordinators, speech and language. There's a whole array of allied healthcare professionals. The mini Mouthcare check, which is we encourage all children within a residential special education setting to have a mouth check carried out monthly and ensure Mouthcare is part of their care plan, and it's allocated and tailored to each individual child's needs. And what we want to do is ensure that, Urshla said before, we want to put the mouth back into the body, encourage support workers to lift the lip. So this is the Smile and Matters document, which was produced by CQC. We're actually under discussions at the moment to look at having a similar policy put in place, but for children and young people in residential settings. So we want to make sure that daily mouth care is mandatory for everybody. So what we've done is, as part of the residential setting, we've produced a mouth check. So every month a child would have a mouth check carried out. This would be done by the support worker who has completed the training. They would look at different areas of the mouth and they would RAG rate it. So it could be anything from green, amber to red. At the end of the mouth check, they would then determine whether or not which status the child would fall into, and a pathway would be created. There's a mouth care guide that's been developed to support the mouth check. And we've also got product guides, flip charts, and teeth brushing charts. What we ask for all the schools to do is to complete a medical history form, a pre-remote oral health check-in. So what they have is from two different sides. So as part of the prevention side, we're also encouraging for a remote oral health check to take place. And this is from the oral healthcare team. And as part of the pilot, what we have done is we've trialed this with dental clinicians, and we've also done it from a dental nurse perspective as well. And what we found was the dental clinicians are very much in that examination mode, but from a DCP point of view, it was very much classed as a preventative dental unit, a toothbrushing clinic. And what we did was we look at the medical history, we look at the remote oral health check, and we're able to establish a picture of that child. And then as part of the remote oral health check, we would put together an oral health care plan. Next slide, please. So as part of the process, what we want to make sure is that we want to put the child and the young person at the centre of the whole process. And we want to ensure families and schools are aware of dental services. So many times families have a child with special needs who may see a general dental practitioner, who may be seen within community or hospital, and then are referred to different services. And sometimes they just don't know which way to turn, they don't know who to go to. So what we want to make sure is that they have a clear pathway to the dental service that they need. We want to make sure that urgent emergency care is linked with oral healthcare teams, and that they can refer the children or young person to the appropriate setting in a timely manner, so they're not waiting for months and months. We want to make sure that all face-to-face contact with a member of the oral healthcare team is justified and tailored to the needs of the child or young person. And most importantly, we want to link the oral healthcare team that is aware of the needs and able to make reasonable adjustments and build a rapport with that child and their family. So looking at the learning disability, autism, any issues that the child may have, putting those reasonable adjustments in place, and ideally a consistent team over a time so they're getting to see the same person. What I will say as well is that all the information that we have produced as part of Mini Mouthcare Matters within the residential settings is that we've put them in a format of easy read, and we've also got a widget format as well, so the child can be included in all those discussions. It takes a collaborative effort through engagement, communication. We want to remove all of those barriers and make sure that everybody is equal and access for everybody. As part of the long term, prevention is key to make this initiative a success, and everybody needs to take a part. So this is just a clip. We were managed to luckily have a trip to two of the pilot sites. So two pilot sites that we've been to is Greater Manchester, and that is the one where we're standing outside because it was pouring with rain. Every child receives a mouth care bag In that, there is the appropriate products, so everything from a basic toothbrush, standard toothbrush, to a super brush. Thank you so much to Riz Products and Emma, who's on the call as well, because she's been really supportive with this project. So lots of information in there about their products. We were really surprised at how many of the support staff who work with these children 24/7 have no idea of oral nurse or dry mouth gels or even a super brush. And these are things that should be part of their routine daily care. The next picture is just a sample of who we met in the Southwest. These are just some snippets of information from our Twitter account. So just to let you know some feedback from the schools, we've worked with a fantastic lady called Sharon Hillman, who is a brilliant advocate for parents and families of children with learning disabilities and autism. And this was an article that I was asked to put forward my views for with Caroline Holland. Next slide, please, Ush. So the future. So obviously the pilot ends in March 22. So going back to that COVID slide, my secondment opportunity was actually only in place until about August, September time, but I took a massive leap of faith and sadly resigned from that post. I loved the people I worked with. I had a fantastic line manager. I had great support, but I thought actually this is an opportunity that I can't let go. So I actually resigned from that permanent post and then took on the new post of overall SES project manager. We're still continuing to work with the project and supporting Mini Mouthcare in other areas. And luckily, I've been able to take on a new role with the Commissioner and Senior Manager and the Southwest as part of the Dental Networks Manager. Next slide, please, Ush. So I just want you to remember that anybody listening to this now, you're never just a dental nurse. And it's really important that through all your extended skills and all your CPD that you do, that there is so much more that you can do, not just within your own dental practice or your area of work. There's so many opportunities out there. Thank you, Ush. But there's lots more going on, so I'll hand back to Ush so she can fill you in.
Thank you. Thanks, Joanne. Brilliant. So I'll just round everything off to let you know that there is more. So even though the hospital initiative is unfunded, we have been quite lucky to be asked to be part of, some of you might have heard of Project Tooth Fairy, which is an initiative that's set up by the North Thames Paediatric Network. And it's to basically manage the backlog of paediatric patients waiting for a general anaesthetic to manage their teeth in London. So the hospitals north of the river, which are 24 in total, so there's 16 district general hospitals and 8 specialist hospitals, have asked us to deliver Mini Mouthcare Matters training. So Joanne has totally led on this, and she has delivered the training module, so trained people to become trainers, and she's trained a group of foundation therapists who are now qualified as trainers for Mini MCM, and they have gone off and trained hospitals. So not only in the UK, but also not only in England, but also in Ireland and Scotland. So Joanne is basically instrumental to managing that team of people. So we're still spreading the word in hospitals. We've also delivered some training in a hospice setting, which has happened with some foundation dentists who are now dental core trainees. They've moved their jobs all over the country. They're still working with the hospices, and Joanne is managing them as well. So she really is doing way more than the scope of her job. And I also sit on the board for the Institute of Health Visitors, who are asking if we can develop a mouth check for health visitors to look at vulnerable children. We're working with the Royal College of Speech and Language Therapists as well to make sure that we can try and get it into their curriculum. I was lucky enough to present with Chief Dental Officer to the Medical Advisory Group within NHS England, that's Prof. Stephen Powis, to talk about Mini MCM. And as a result of that, we had some contact from the Royal College of Physicians Training Board to say they want to make sure that oral healthcare is included for medical practitioners, to make sure it's on their curriculum, because it's something that's always forgotten, but does need to be integrated a bit further. So you can help by engaging with a special education setting initiative. If there's schools around you or you're linked with schools from an oral health promotion perspective, make sure you talk about this initiative. You can send us an email to see how you can get involved locally as well and connect with people around you. And like Joanne did, look for opportunities. And it takes for people like me to spread the word. I can't actually remember the last time I did any collaborative work with a dentist. I actually can't. I think the most work I've done is with hygienists, therapists, nurses, speech and language, health visitors. I can't remember the last time I did work with dentists, not because I don't value them, I 100% value them, but they are so overstretched and undervalued a lot of the time, and they're a bit disenfranchised at the moment. So working with everybody else, because it is everybody's business. And really important for Mini MCM, it's about consistency and branding. So if we're going into hospices and we're going to work with speech and language therapists, there's no point having lots of different groups with different names. And it's when you have that consistent brand that we can take forward, then becomes embedded as part of our culture. So like DC by one takes a little while, and unfortunately COVID might have put a bit of that on the back burner, but we have to keep on plugging because eventually things will make a change. So making sure that we make every contact count with our patients. So if you see a child with learning disabilities, autism, any sort of additional needs, make sure that when they go back to their hospital settings, they know about Mini Mouthcare Matters. And if they're going into hospital, if they come and see you, just say, don't forget to take a toothbrush with you when you go into your hospital appointment as well. Really important to see where you can make that little impact as well. So we are putting the mouth back in the body. And as dentists, oral healthcare teams, we are more than just the mouth. So I know that Fiona had asked the questions about, are we having training in uncomfortable conversations about things like recognizing oral cancer? I'm really big on this. I think it's really important. We know, for example, the links between obesity and oral health. And if we get a patient who comes to see us who is morbidly obese, as an oral healthcare team, we make a note of it, but we don't actually talk about it. So as healthcare professionals in the mouth, we need to start talking about general health. So it's not just about putting the mouth back in the body, it's about us feeling empowered to talk about general health as well, because we are all healthcare professionals. As DCPs, I wanted to raise with you as well, British Society of Paediatric Dentistry has a dental care professional membership and a prize, and we really, really want to encourage people to engage with us because year before last, we had a lot of people applying for our DCP prize as part of our conference. Last year, I think we only had 2 people, and it's such a shame because we really want to encourage more non-dentists to be a part of that society and to sit on council and sit on groups, maybe apply to be president one day. We really want to make sure it's equal for everybody. It's way beyond just being dentists. So if you're keen to get involved, please have a look on the BSPD website. If you're doing any projects you want to promote, it will be published in International Journal of Pediatric Dentistry, so you can get that as an abstract. If you're not selected to present, you'll get it in the journal anyway. And it's a really good time to be a member. And we've got, I think our membership fees are quite reasonable. And please do contact. You can subscribe online as well. And I'm more than happy to speak to somebody if you want to be a member of that or work on any joint projects as well. I'm always keen to do some collaborative work. Oh yeah, and there's a prize. I forgot about that. So there's a prize as well. So there is an added bonus of applying for that prize. So this was my son on his first birthday. And that was the last time my father saw him before lockdown happened, about 2 weeks later. And then if you can believe it, that was when he saw him the next time. He'd grown into a little toddler and just got admission into a school now. It's crazy. Life has gone so quickly. But, it's all about moving with the times, making sure we make a change for this group of kids, because tomorrow we don't want in 30 years' time them to be having the same conversation we're having 30 years on, as we know things haven't made a difference. And I had to put my third child in here, Elwood the elephant, as well, because he always makes an appearance everywhere in my life. And if you follow me on Twitter, do follow us on Twitter, because we talk about lots of interesting things. You'll see my daughter was in after school club and she did a little picture and she came home and I said, baby, what's that? And she said, it's Mouthcare Matters. And she actually drew the elephant from memory, which means it's far. My husband just put it on my birthday cake as a logo. It's really becoming a bit of an issue in our house. But please do engage, because it's really, really important. And we value all of you as part of this group and collaborative as well. Thank you very much for inviting us, Fiona and team. Thank you.